Hello, this is Danny Blyth from the College of Integrated Chinese Medicine, looking at 6 stages and 4 levels. Please pause and read. This is for acupuncturists and herbal students only. So the 4 levels or 4 aspects tracks wind heat or damp heat as it penetrates deeper into the body's defences and damages the yin. So warm disease, Wen Bing, is mentioned in the Neijing and it's mentioned in the Shanghan Lun. It was Wu Youxing who first discussed Li Qi, pestilential qi, as something that was contagious rather than something that was caused by extreme weathers. And it was Ye Tianshi who developed the idea that there were 4 levels that could be tracked. And this was at a time when lots of war and epidemics were plaguing southern China. So a warm evil is a strong pathogen that invades via the nose and the mouth, which is different to wing cold, which enters through the skin, the back of the neck. It's contagious, it's a strong epidemic pathogen, and there's always a fever present. So the 4 levels again are Wei level, defense level, Qi level, Ying, nutritive level, and blood level. So we have fever and chills simultaneous, fever predominating from the fight with the Wei Qi, slight sweating because we're talking about wind heat, and slight thirst and the pulse is floating and rapid. There might also be throat symptoms, frontal headache, body aching, and the runny nose this time with yellow discharge. If there's also dampness, you might get heavy head and chest, so like a muzzy head or a head wrapped in a towel, nausea and vomiting, stomach upset, swollen glands, sticky taste. There might also be summer heat or wind dry heat with a dry cough, dry skin, anything that affects the Wei Qi level with heat involved. At the Qi level, the pathogen moves from the exterior to the interior. And we get the 4 bigs like we did with the Yang Ming stage of the 6 stages. Big sweat, big fever, big thirst, and big pulse. As well as the 4 bigs, we get different symptoms depending on which of the organs gets involved. So with lung heat, we get the 4 bigs plus a productive nasty cough, breathlessness, stuffy chest. Stomach heat is the same as Yang Ming channel stage, so we get the 4 bigs. So if the lungs looks like a chest infection, stomach heat looks like flu-like symptoms. Stomach and intestine dry heat is the same as the Yang Ming organ stage. And gallbladder heat is very much like the Shaoyang stage, but with more heat signs, so more fever than chills. With stomach and spleen damp heat, the fever is unusual. It's continuous, but sweating happens and it decreases and then it starts up again. So the heat builds up, heat's released by sweating, then it builds up again. The sweating's often from the head and the upper body, strong smelling and staining. You also get typical damp signs, heaviness of the head and body, blockage of the chest and abdomen, nausea, loose stools. With residual heat at the Qi level, the internal full heat has started to damage the yin. So we get a similar pattern of sweating. If the lungs are involved, then we get a hacking cough. If the stomach's involved, persistent nausea with occasional vomiting. And if the Shen is involved, restlessness, insomnia, irritability. So the Ying is the next layer in, and this is typified by fever and rashes. Basically the internal heat or fire has started to injure the yin and disturb the Shen. So we get high fever that's worse at night, dry mouth with no desire to drink, and we get insomnia, mental restlessness, aphasia, and macules, which are clearly demarked areas of the skin that sit underneath the skin. So they're not like papules, spots which sit on top of the skin, and if you push a glass down on top of them, they don't disappear. When the pathogen reaches this stage, it's become dangerous. This is time to get somebody to a hospital. So it may be complicated by pericardium, heat, mental confusion, delirium, hands and feet get cold, might be complicated by internal wind, so seizures, convulsions. So at the blood level, the pathogen has reached as deeply in as it can get, and it's typified by rashes and bleeding. So we get high fever, irritability, manic behaviour, these macules that we talked about before, and blood which might come from any part of the body. The tongue at this point is deep red with no coat, and dry. The pulse is wiry and rapid. The blood and yin have been damaged. So if there's bleeding, it's said that heat victorious moves the blood. If there's internal wind, then heat victorious stirs wind. You may also get yin collapse or yang collapse if this gets near to death. So this marks a progression of the illness getting deeper and deeper, but remember, it might skip from one level to another level. It might show simultaneous symptoms of two different levels at the same time, but it essentially gives you a map of where the pathogen's located. So that's the 4 levels. Thank you for getting to the end. Here's some further reading and bibliography. Pause it if you want to have a look.